Okay, welcome everyone. Welcome to today's webinar with ACHS. As you roll in, tell us where you're joining from. We'd love to hear where in the country, where in the world you are, and maybe kind of a little bit of something about you in the chat. Everybody should have the ability to chat with both the host and the panelists and the others in the group. So just make sure you're switched over to everyone so everybody can see your questions. Um, right, Denver. Hey, Catherine. New Hampshire. Okay. Wonderful. Oh, Savannah, Georgia, kind of near me. I'm in South Carolina, so we're getting all the corners covered.
Mhm.
All right. Great group forming. Thank you all for being here once again. We're excited today. We don't always get to do webinars with special guests, so we have one today, and we're excited um, to be talking with Nicole Hodson today. We'll have a little bit more information about her in just a moment. One thing that I wanted to put out there just before we get started. Our guest Nicole is in the path of some weather today, and hopefully everything will stay on track. But there is a possibility of power outage. So in the event that today's webinar gets cut short, we do have a plan of getting back together and recording a follow-up that we can send out to everyone. So if you are on today and you get cut off, or if you're looking at this later and you registered but weren't able to attend, and there's some interruption in the recording, that would be why. So we just hope everything goes well, everybody stays safe, and we can go through everything that we have to look at today. Can everyone see my screen? Great. So we'll go ahead and take a quick look at who we are. So those of you who have joined before in other webinars, you may have seen this, but if you're new to ACHS webinars, we like to just do a little overview of our school. We have been around in some form or fashion for 45 years, always in the distance learning space. So even before there was online programs and internet-based learning management systems, ACHS was in this industry, in this part of education from a distance. So sort of a pioneer there. And now we've grown to over 60 countries represented, and served over 10,000 students in our existence. You see there, we've specialized in distance education from the beginning. We've been accredited by the DEAC since 2003, and really proud about that to partner with them. We're also a certified B Corp. If you're not sure what that means, I encourage you to look into it. What it means for us is that aside from being an institute of higher education, we're also think about our organization as benefiting the planet. We put people and the planet over profits, and do a lot of things here internally at the school to impact our communities, either by volunteering, or providing services of some sort outside of what we do here at the school, just so we can be a positive impact on the communities that we're in, and promote sustainability wherever we can. So that's something we've been proud to have that designation since 2016. Also, if you're not familiar with our history, at one point, all we really had was a couple of certificates. So if you look at the program offerings that we have now that range all the way from certificates to micro credentials, all the way to the doctorate program and everything in between, that represents a lot of growth over time and contributions from industry experts, our own faculty and staff, and people that we partner with, like Nicole. So uh, we're 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 excited to be leading the advancement of health and wellness education out there over the time. So the first introduction, I'm Troy. I'm the director of enrollment here. I am just going to be as quiet as I can after a little while, some introductions, and turn it over to the experts. But I'll try to keep an eye on questions in the chat. We'd love to see your questions as they come up. And if I interrupt and throw one out there, Nicole or Patricia, I'll just let you know. Also with us, Dr. Patricia Kaufman, our Dean of Integrative Health and Nutrition. Um, Dr. Kaufman, anything you'd like to add to the beginning?
No, but it's nice to be here and nice to see so many.
Thank you for being here. So we've already done some housekeeping with the weather report. We're going to talk with Nicole Hodson here in a minute and let her kind of walk us through some interesting information and just her passion and what she does. We'll look at the programs here at ACHS that align with the BCHN, and what you can kind of look out on our end that might lead you that way. We'll take some questions if you have them in the chat. Along the way, if we don't get your question throughout, we will have a little moment after we look at programs to just see if there's any questions that are lingering. And we will be recording, like I said, and if you're not able to stay on the whole time, we'll send out the recording later on in some form. Hopefully, we'll get through the whole thing. Okay, so our special guest for today, Nicole Hodson. Nicole is the executive director of the NANP, and has been with NANP since 2007. Um, so she can probably tell you a little bit better than I can, but just a little tidbit. Um, Nicole, after she significantly improved her own health and her husband's health at one point in her life through Whole Foods nutrition, and that inspired her to leave the managed healthcare industry to pursue a career where she could have more of a positive impact on change. If you've met Nicole, if you're familiar with her passion for the industry is infectious. She's passionate about what she does and what it means, and has made it her life's mission to promote whole food nutrition for those who teach it in every way possible. So, Nicole is dedicating her career to putting holistic professionals to work and protecting their right to practice, which we, of course, are very grateful for. And we're honored to have you with us here today, Nicole. I am going to turn it over to you to fill us in on anything more about yourself. And I'm also going to stop the presentation for a moment so you can share your screen.
Great. Well, thank you, Troy, and thank you, Patricia, for having me. I'm very, very grateful for our partnership with ACHS, and we're the whole organization is. Um, you may not know. I want to a nod to Patricia. Patricia is has been elected as a member of the NANP Board of Directors as of January, and we're just so thrilled to have her, and she's heading up our Educational Standards Committee, which I'm so very grateful for. So um, I'm delighted to be here. You described me. We don't need to talk about me anymore. I will say that NANP is my absolute biggest passion. So let's just kind of start with what is the NANP? And I am going to share my screen, and I'm going to take you over to our website. So NANP stands for the National Association of Nutrition Professionals. Our organization has been around. This is our 41st year. Last year we celebrated 40 years. And we are the industry association for holistic nutrition professionals. So every industry has their sort of flagship association. Medical doctors have the AMA, nurses have the ANA. We have the NANP in our industry. And we are a professional business league, which means that we are focused on making sure that we uphold the standard of the industry. We are a self-governed association. We're a 501c6 nonprofit. What that means is that the six, instead of like a three, so charity organizations are a 501c3, NANP is a 501c6, which gives us the ability to lobby on your behalf and to ensure that we have as solid a place to practice in every state as possible. And so we do have a legislative arm. Our legislative specialist is Laura Waldo, and she is one of the most hardworking people I've ever met in my entire life. So she works with our members to help them understand their scope of practice. So I just wanted to kind of give you a little bit of foundation of who the organization is and why we're here. Um, I invite you, if you're unfamiliar with the NANP, to please go to our website, which is very simply nanp.org, and just spend some time. look around and see what we have to offer. I mentioned that we're a professional business league. We're a membership organization, and we offer three different levels of membership. Student membership for sure, and that would be people like you who are either already attending or considering attending a school like ACHS. We have our professional members, so those are people who've gone through nutrition school and now they've graduated. And then we have associate members, and those are people who maybe their legal scope of practice allows them to talk about nutrition, but they haven't graduated from nutrition school. So our focus here today will be on students and professional members. And you can learn about what membership offers. If you go to the membership tab, we have all kinds of information for you there that I would encourage you to check out. So I'm here today to talk about becoming board certified in holistic nutrition. Our BCHN credential, and I'll go to that page on our website. This credential is our flagship credential. We recommend this for everyone who's serious about a career in holistic nutrition, whether you're planning on having your own practice, whether you're planning on looking for a job elsewhere. We understand that the BCHN carries weight that will help you demonstrate that you have achieved a level of excellence within your field. When I go to my local hospital, when I walk in the front door, there are huge banners advertising the doctors that have earned their most recent board certifications. Our industry is no different. Becoming board certified is very, very important, not only to demonstrate to your clients that you've achieved the highest possible credential in your field, but also to allied health professionals who may want to refer to you and to people who may want to hire you. And we'll talk about that a little bit in a minute. So, who's eligible to sit for this exam? Okay, so there are two requirements that you have to meet in order to apply to sit for our exam. The first one is that you have to be a professional member of the organization. And so you've either, you're getting very, very near graduation or you have graduated. And then you also have to have gone to one of our approved schools like ACHS in a program that we'll talk about later on, which programs will qualify you for professional membership and to sit for the board exam. If you have not gone to an approved school, but you have an education, sometimes people come to us and they've gone to this school for a little bit and that school for a little bit. We can do what's called an independent educational review to figure out if you meet all of our educational standards. But of course, we highly recommend that you go to a program like what's being offered at ACHS and graduate from that program. Once you have graduated, or if you're getting ready to graduate, then you can apply. The application process requires, of course, an application to be filed. We ask for all kinds of things. I will show you some of the requirements here so you can kind of get a little bit familiar. I'm not trying to make you dizzy, I promise. We do have professional membership, of course. There's an application fee and then the exam fee. We're going to be looking for letters of reference. We have a professional conduct agreement that is within the application that we do ask for a signature on. We're going to be looking for a photo of you because that's going to be needed when you actually take the exam. Which is proctored, by the way, online. We'll need a copy of your driver's license or state-issued identification, a copy of your resume or CV, proof of liability insurance if you're practicing currently, a copy of any diplomas or certificates that you possess in our space, any licenses you may hold, and That's redundant. Need to get rid of that. Sorry. We have a brand new website, so I'm finding little things here and there that need to be cinched up. That's one of them. Official transcripts from the school that you graduated from, and then contact hours. So I don't want to scare anybody. Um, if you are a new graduate, we have a process whereby we identify you as such, understanding that you most likely have not collected the 500 contact hours that we look for in the completion of the application process. So um, we give you a 12-month period after you graduate from which you can apply to take the board exam. During that time, you're considered a new graduate from the date that you graduated, 12 months out. Anytime within that 12-month period, then you can actually sit for the exam. Okay, so you've got some time. Once you pass the exam, we give you a full 2 more years to collect your contact hours. So if you're going into private practice, we're giving you a lot of time to collect those hours. If you're going to work for somebody, then that's still a lot of time for you to collect those contact hours. So let me talk a little bit about what are the contact hours. Okay, so we have two types of contact hours: direct contact hours and indirect contact hours. Okay, direct contact hours, those are that's the time that you spend with your client or working on things for your client. Okay, we need 250 of those contact hours to be direct. So you're going to want to make sure that you can fulfill that requirement. Indirect contact hours are the hours you spend working on anything else: handouts, presentations, presentations, anything else that doesn't have to do directly with your client work are considered indirect contact hours. And that can be anywhere from 250 or fewer if you have more than 250 direct contact hours. Okay, that's a lot. I'm going to pause here for a minute. Troy, do we have any questions so far?
Nicole, I have a question for you,
Yes.
and which I think many others might have the same question. Can they start their contact hours? Can they go retrospective? Can they have those contact hours before they even apply for to sit for the exam?
That's a great question, Patricia, and it's really pertinent, especially for a school like yours, because sometimes you have people who've come from an industry that's allied, where maybe it was within their legal scope of practice to talk about nutrition with their clients or patients. So they can carry those hours over for sure. Here's the distinction, and I have to be very clear about this because I messed it up one time when I said this, and I want to be real clear. If the educational program requires casework, working with a client to satisfy school, to satisfy the graduation requirement, those clients don't count, because that's actually a part of the educational process, right? Any clients that you're seeing outside of that process do count. So, for example, when I went to nutrition school, I had to have 3 people that I worked with, but I started working with other people too as I got toward the end of my program. All those other people's hours counted. It's the ones that are needed for school to graduate that don't count. Does
So,
that?
Nicole, I think you may have just touched on the question we have from Heather.
Okay.
Can we collect hours while doing the ACHS Holistic Nutrition Program, or do you have to wait until school is completed? So,
Okay, good. I hope so, Heather. And if you have a follow-up, put it in there, okay? Okay. All right. We have a study guide. I highly, highly recommend that you read the study guide at least once all the way through. There's a lot of information in the study guide, and I want to be really clear here. It's a study guide. It is not a prep course, okay? In the study guide, we will tell you which materials you're going to want to study for the board exam. All of the questions that are in the exam have been sourced from those books and links. So we have links for you and we have books that you're going to want to buy and study. Okay. It's critically important that you use those materials to study for the exam. We're in an industry where sometimes there is contradictory information about things. Soy is a great example. Some people think it's great, some people think it's not. And so, in order to have a properly validated exam, we had to have a source from which to pull our questions and answers. That is where you will find the answers to the questions on the exam, not on the internet, not in other sources. You're going to want to study those sources. So in the study guide for each domain, there's 5 domains for our board exam. For each domain, we'll tell you what are the key concepts you want to study, what do you want to be able to do based on those key concepts, and then we'll provide you with some sample questions and answers so that you'll kind of get a feel for what are the questions like on the exam. Okay. I think I mentioned earlier the exam is proctored electronically. Okay, so what that means is when you sit down to actually take the exam, there's going to be a proctor watching you. They're going to need to be able to see everything that is around you. Literally, they're going to have you take your camera, your laptop, whatever you're using, and they're going to want you to show them everything that is around you, everything that's on your desk. You do need to be sitting at a desk. You can't sit on a bed. You can't sit on the floor. They're going to want you sitting at a desk. Okay. Um, so the exam, we allow 3 hours to take the exam. Honestly, no one's really ever gone beyond an hour and a half. So it's definitely doable. It is not open book. So you're going to have to, it's all going to have to be in here in order for you to be successful in the exam. I'll show you what the study guide looks like. I recommend everybody, like I said, please read through this. There's a lot of information here, and the only way that you can get a clear picture of what you're going to need to understand and know is by visiting and really studying this study guide. Okay.
And Nicole, I, to let everyone know, I just took the exam. And so I did use that study guide and I found it very useful.
I'm so
So
glad to hear
yes,
it.
so please look at the study guide if you plan on taking the exam.
Yeah, thank you. Yes, definitely. This is it. It's right here. Um, okay, and I want to point out this particular video. It is an excellent, excellent short video on how to study for an exam like this. Okay. And Troy, if you can grab this link right here and maybe put it in the chat for everybody. It's probably about halfway down the page. Highly, highly recommend. Take the time. Honestly, I've watched it like 3 or 4 times, and every time I watch it, I find something new that I need to take note of. It's an excellent video that will help you kind of wrap your head around how to organize yourself, how to prepare for an exam like this. Um, I will say this exam is challenging as a board exam should be. It shouldn't be easy, but it is accessible. And Patricia, would you agree? Yeah.
Yes, sorry, I was typing a message
Yeah, yeah.
to one of the in the chat. So
Yeah, it's doable. I just want everybody to know it's doable, but you do have to prepare for it. Okay,
you
and
do, and I would just add like the biochemistry. We can always forget that, and so just go through that study guiding because it will jog your memory of like, oh yes, I need to review my biochemistry a little bit more, or I need to do review my nutrients profiles a little bit more. So.
yeah, thank you. Absolutely. It's so important to be prepared for something like this. I'm I can't emphasize enough how important it is. So I'm going to kind of go through some of the frequently asked questions. We're still on the same page of our website. All this content is all here for you anytime you're ready for it. What's the best way to study for the exam? Of course, we talked about the study guide. I showed you that video. Um, but also, I want to make sure that you're aware that we have study groups forming all the time. So when you join the NANP, you'll get access to our online community called My NANP, and that's really where kind of everything for our members lives, including what we call circles or groups. And we have a board exam study group that's very active. It's always recommended that you join a study group. Now, you may have friends that you are going to school with right now. And maybe you want to form a study group with your friends, and that's a great idea. But if you don't, and you're looking for other people to join, I highly recommend going in, putting a query out. Hey, is there a study group I can join? Or is anybody looking to put a study group together? It's a constant thing. It's happening all the time. So I highly recommend that. We talked about how the exam is proctored. We use a company called ProctorU. Once you apply to take the exam, you'll get all kinds of communications about how to schedule your exam, how to work with ProctorU, all of that. We'll walk you through the whole thing. If I can just say one thing, the most important thing I can impart to you today is read what we're sending you because everything is in there. I promise, promise, promise. When can I take the exam? You schedule it at a time of your convenience. If weekends are better for you, that works out perfectly fine. We talked about how much time is allotted. Um, if you need an exam accommodation, we do have a policy around that. I would encourage you to read that. It is not open book. You cannot bring notes. That's what the proctor is going to be watching for. A passing grade, 70% correct is a passing grade. So that's the minimum. Hopefully you'll be way higher than that, but that's what we're looking for. You will get the results immediately after you complete the exam. And we will also send you notification through the US mail. What if you don't pass? Don't panic. You can take it again. You can take it 2 more times for a total of 3 times. And what title do you use after you graduate? Now, if you came in as a new grad and we don't have your contact hours yet, but you passed the exam, you can refer to yourself as board certified in holistic nutrition candidate. Okay. You'll notice that we use the little trademark, the R inside the circle after. Our title has been trademarked by the US Patent and Trademark Office, which also allows our title to be used in any state of the nation. Okay. Very, very important. And so when you pass the exam, if we're waiting for your contact hours, you're a candidate. Once we get your contact hours and you're fully credentialed, then you can drop the word candidate. We do ask you to use the little R inside the circle. It does help people understand that this is a trademarked title. Okay. We have this exam is overseen by a board. These are all volunteers who are helping us maintain policy. You might see a familiar face here, Francesca Orlando, who I believe is either currently or is going to be working at ACHS. And she is currently the co-chair of our board, and in the summer, she will be taking over as chair. So we're delighted to have her in that role. All right, why is this exam important? This exam is important because if you are looking for job opportunities, you of course want to have the credential that you got when you graduated from school, but you also want to continue to add to your credentials. You will always want to be adding to your credentials over your career. It is incredibly important that people understand that you continue to learn and grow. So, having the BCHN behind you is a way to demonstrate, as I said earlier, that you've achieved the highest that you can in your industry. I can tell you that there is a somewhat celebrity figure in our industry, very highly regarded, who has, out of over 400 applicants, recently hired two people who carry the BCHN credential because they carried the BCHN credential. We also understand, I just recently we had a person who was scheduled to take the exam and had to push it up because she was offered a job by a doctor's office who said, I will hire you after you pass the board exam through the NANP. So it's starting to get some recognition in a way that can really get your not only your foot in the door, but might even be a requirement for the job. So I really highly recommend for those reasons. What sets our board exam apart from other board exams? I can tell you that I know firsthand that our exam is validated. Some exams in our space are not. That means that we can point you to the answer to every single question. It isn't a group of people sitting around just pontificating and coming up with questions. They are coming from sources, text sources. We have a credentialing process. Let me talk a little bit about this. If you're a registered dietitian and you go to work in a hospital, that hospital is going to put you through a formal process called credentialing, where they look at your insurance, your resume and CV. They look at your background. They do like a background check, which is checking with the National Practitioner Data Bank to ensure that there are no negative reports against you, no malpractice, no if you carry a DEA license, no DEA issues. That process is traditionally handled at the institutional level, medical groups, IPAs, which are individual physician associations, hospitals, skilled nursing facilities, those types of places will traditionally handle the credentialing process. When our board exam was developed, we wanted to be able to provide an additional level of credibility and validation to the people who had taken our exam. So we're doing the credentialing process here at the association level. Very unusual, and I'm very, very proud of the work that we do. We do check the National Practitioner Data Bank to ensure that there are no adverse reports against every single candidate who passes our exam. That's an additional level of scrutiny that you can describe to your clients and to allied health professionals. Listen, I've already been credentialed, okay? And they can verify that through us. So I just wanted to make sure that you understand the depth to which we go through to ensure that every single person who carries our credential should be carrying our credential, okay? All right. Um, so we talked about how to prepare. I really want to kind of talk a little bit about our conference. Can I talk about our conference, Troy? Is that okay?
Sure.
Okay.
Let's
So
jump into
I'm so excited, and I will share my screen again. We're coming up on one of my favorite times of year, which is our annual conference, which we do host in person. This year, we are going to be in Bellevue, Washington, at the Hyatt Regency there. We've been to this property before a couple of years ago. It was phenomenal. Our conference spans over 4 days. We start in the afternoon on Thursday and we end midday on Sunday. We have two keynote speakers that kind of bookend the conference experience. I'm so excited. Our opening keynote speaker this year is Deanna Minnick. Some of you may be familiar with her. She is a phenom in our industry. I cannot wait to not only see her again personally, but to bring her to our audience again. And then our closing keynote this year is going to be Sean Talbot, who is also a phenom and primarily in the mental health space in our industry. And he's also a board member. So we're very, very happy to have those two. In between, we do a lot of fun things. And so if you're curious about what's on the agenda, I encourage you to go to our website. It's healcon.org and go to the on the agenda menu item and look at the schedule at a glance. And that'll give you an idea of what we're going to be doing every day. I'll tell you this is not only an educational conference. We have a lot of fun. I mean, a lot of fun. We do morning yoga. We have an incredible after party after our dinner on Saturday night where we do our award time and we have a little meeting for everyone. Um, and so I really encourage you to take a look. I dropped my mouse, pardon me. I encourage you to take a look at the schedule and just kind of get a feel for, um, goodness, sorry about that, guys. Get a feel for what we're doing there. Okay, it's not working. I'm so sorry. I'm having a technical challenge here. I dropped my mouse and now it's not responding to me. Okay. Pardon me, guys. I'm really sorry. I don't know why this is not working now. I'm going to have to switch over to my laptop. I'm so sorry.
No problem. Technology always jumps in.
Nicole, do you want one of us to share and then you just tell
Would
us
you?
what to do?
Yeah, I can't stop sharing. Are you able to take over?
Oh, you can't stop sharing.
I can't get my mouse to work at all now. It's totally broken. Goodness, I mean, it's broken.
All right, Patricia, I switched it over to multiple panelists being able to share, so you may be able to share also.
Okay, let me bring it up.
I'm so sorry about that, guys.
Okay. Okay, everyone can see that?
Yes.
Right? Okay, tell me where you want me to go.
I'm the only one who can't see it, I think. I'm still
Oh,
seeing my
okay, I'm
screen.
on the agenda. So you want me to go
Okay.
at schedule at a glance?
Yeah, if you would. Yeah, thank you.
Okay, so,
Oh, there
uh,
it is. Okay, now I can see.
okay, tell me
Okay,
where you
good.
want me to scroll.
I just really wanted to kind of just gently scroll through. I will talk about Friday and Saturday. So I mentioned that we have general sessions, keynote speakers on Thursday and Sunday. In between on Friday and Saturday, we offer two consecutive sessions. So they're happening at the same time. But here's the good news. Don't panic. Everyone who registers for our conference afterwards will get the recordings of the entire conference session panel. So if you choose to go to one speaker, but you really wanted to see the other speaker who's talking at the exact same time, you will get the audio recording along with the presentation, their slide presentation in video format after the conference just by getting a ticket. Okay. So you don't have to miss any content. And that's really what I wanted to say about all of this. I mentioned our after party. It's so much fun. We do a theme every year because our people like to dress up. And so this year we're having a sock hop, 50s sock hop. We do encourage people to come and have just a good time. It's an opportunity for us to let our hair down and be together. It's the one time of year that we can be together. And then the last thing I want to say about HealCon is I'm so happy to say that we offer a student scholarship. We collect donations, and then we then are able to bring as many student scholarship winners as we have the funds to bring for registration. And I'm very happy to say that we have collected enough so far for 4 scholarships, and all 4 of those scholarships are going to ACHS students. I couldn't be happier. You guys have shown up in such a great big way for us, and I couldn't be more happy to bring all of these wonderful people to conference. So I've talked a lot. I'll relinquish the microphone here and open things up.
There are some questions about contact hours that I don't know for
Mhm.
certain. So, if someone uses friends and family for nutritional contact hours, can they use those?
Mhm.
Okay.
You can. And here's the thing about contact hours, like on your contact hour form, we don't want their names. We just want their initials for privacy purposes and HIPAA. We don't want that information. So we're just looking for initials of the people that you've worked with. And I worked with friends and family for sure. And that's your starting point, right? That's the place from which you hope people will spread the word and you'll get more clients.
Um, and then someone, Shannon, she works with clients. She's a holistic nutrition coach and she works with clients. Does it have to be your work? So when you're working with a client, does 75% need to be nutrition? Like, is there a percentage of your client interaction that needs to be nutrition focused?
Well, we are holistic nutrition, right? And I'm sure the same is true for you, Patricia. I'm not practicing any longer, but when I was practicing, you know, I'd say 50% of what we talked about was nutrition, and then the other was stressors, spiritual issues, community, all the other pieces and parts that are holistic nutrition, right? It's not just straight nutrition. Absolutely, those hours count.
Okay, and then one other one, it's not regarding contact, but someone is graduating in the summer, end of
Mhm,
summer, and would like to know if they can start the process now
mhm.
for
Um, and so
joining.
it kind of depends on what program they're in. What I would recommend is that you talk with your instructor. Some programs are shorter, meaning that, that last part of the program might also be shorter. Traditionally, what we really say to people is if you're about 3/4 through your program, that's about a good time for you to start thinking about applying. And now, in order to become a professional member, you have to have graduated. Okay, so that's important to understand. But can you start the process of looking at things? Absolutely.
Troy, did I
There
miss
was,
any?
yeah, there was one question about the fees to attend the conference.
Yeah, that's a great question. I should have gone over that. Okay, so we're currently in early bird registration. If you are a student, we give you the ultimate absolute discount. It's $590. Okay. And currently, you can split that payment up in two, but the second payment would have to be due by March 20th. So it's kind of coming up pretty quick. And then I believe, I want to say it's 697 or so for professional members of NANP during early bird. But I would definitely go to the HealCon website and take a look at the registration. Check my numbers. I might have flipped a couple of numbers there. I do want to say I didn't talk about this. We provide 5 very, very carefully curated, beautiful buffet meals. as well as a welcome reception. We've literally been working on the menu since August with the chef. We look at every single ingredient, and if there's something in there that we don't like, they have to find an alternative. So beautiful food, and that's included in your registration fee.
That's awesome. Thank you. There was one other question. If someone is a CNS, is there a different process?
There is not a different process. Actually, you do qualify to become a professional member of NANP and go through the whole process.
Thank you. Well, and then actually there was one more question, but it's actually a great segue back to our other presentation about what programs are needed to qualify. So let me switch back over to our slides here. And so we have a listing here of program alignment. Just before I turn this over to Dr. Kaufman to kind of touch on some of these, we get this question a lot in admissions from students that are brand new and they're just starting to think about this as either a new career or, just a new frontier they're looking into. They may or may not be familiar with the BCHN or just the concept of an industry credential like this. So I think you've covered this very well, and I appreciate all the information that the programs themselves do not certify you. They're preparatory for that. And ACHS makes it their mission to seek out partnerships like we have with NANP wherever we can that would benefit our students to take the next step and just continue adding that onto their career and their resume. So, um, but I'll turn this over to Dr. Kaufman just to kind of touch on the programs that we offer here that are in alignment with this credential.
Thanks, Troy. So just to reiterate, all of these programs that you see on this screen, the slide, were approved by NANP to have the right coursework to fit for the BCNN. So 24 credits, required credits in different areas. And so all of these qualify. So we have the Diploma of Holistic Health, then we have the 2 associates, and then we have the Bachelor's of Science in Holistic Nutrition and Integrative Health, and then the 2 masters or 3 masters of science. And then the Doctor of Science is also the one in integrative health. So they provide you with the right coursework to satisfy the BCHN requirements to sit for the exam and to get credentialed.
Great. Thank you for covering that. We have a couple of questions. I'm not sure about one of them. We may have to look into it, but Kendall previously the associate in herbal medicine at ACHS qualified. Does it still?
I'm not familiar with that. Yeah, we'll have to look into that and get back to her.
So we'll check and circle back, Kendall. And then, sorry, go ahead.
Oh, yeah, I was reading Sierra's.
Yeah, Sierra graduated from the MS in holistic nutrition and doing an internship as a holistic nutrition intern with the Nourish Center. Would I have to wait until I graduate the doctorate program?
No, Sierra, you could sit because the Masters of Holistic Nutrition satisfies the requirement.
Yeah.
So you could start. Yeah.
Yeah. On the list here, so you've passed that barrier. So
Yes. Yes, go from the top to the bottom. So if
yeah.
you're at the bottom and you started at ACHS at Doctor of Science, that's going to qualify you. But if you did any of the ones previous, that qualifies you as well.
Yeah, and that's a good point too, because we do have so many students that just either for preference or for just, life reality, sometimes hopping into a bachelor's program that takes a while longer is a commitment that seems very big. And so we also often talk with students about starting with a smaller program like the diploma, and then rolling those credits into multiple programs. The benefit there is if something were to happen along the way to that ultimate goal of the bachelor's or the master's, that you have credentials that you're earning along the way, instead of putting that single endpoint, several years out in front of you. So, and then you see how everything is structured to continue to grow. Well, I believe we have some pictures here of students from the 2025 HealCon. Um, does anybody have information on the presentations here?
Yeah, so these are poster presentations, and I know a number of you on the webinar today have submitted posters. And so I believe, Nicole, there were 6 ACHS last year. And the one nice thing about the posters, if you get selected to present at HealCon, you then get your abstract published in IMCJ and also PubMed.
Yes,
It's a huge deal.
yes,
Wow.
yes. We had a great number of submissions this year, and the poster session, if you didn't submit one this year, consider next year. It's a huge opportunity. It's just a huge opportunity. We have the president of NANP presented a poster a couple of years ago, and then that afternoon happened to be sitting next to the medical director of a very prominent dietary supplement company in our space. And they picked up her research and they have developed a dietary supplement based on the research she presented as a poster session.
Wow. Real impact.
It's an opportunity. Yes, for sure.
You mentioned having fun, so we wanted to put this in here. That's our president, Tracy Abel, with the students at the poster. I know I don't want to speak for Tracy, but I know that she has a great time and just really values the partnership. So
We adore Tracy. ACHS has a booth. We'll have a booth at our conference this year. I really encourage everybody to come and say hi and be a part of things.
absolutely. So there's some more information there. We did put the link in the chat, but when you get the recording and we'll also supply the slides from today's presentation. You should be able to just click right on there and take you right where you need to go. So I hope that's helpful. Um, Dr. Kaufman graciously put her information in here if you have questions or discuss programs, qualification that go beyond the admissions level. If you're thinking about a program, we'll talk about this in a second. The admissions team is going to be able to help you with most of that, but we also know that there are questions that we get that are beyond our knowledge and they're very specific, just like we've had some today. So we are grateful in admissions to be able to reach out to Dr. Kaufman, to Nicole, who all the resources that we have in these industries just to find out what the right information is so that we can help you make the right decision. So thank you both for your input and your willingness to answer questions and help people take this step that can be a little bit daunting at first to think about. So lastly, this is our admissions team. So I see a number of names on here that I recognize, students with us already, but I also see some names on here that are in the process of becoming students and some that I don't recognize. So welcome. If you are thinking about this and haven't spoken to admissions yet, you can go to that website or that link right there and you can set up a meeting with any of them directly. If you've already inquired, you will have already been paired with someone and they probably have been reaching out to you. But if you're not getting the messages for whatever reason, through multiple technology reasons, feel free to reach back out and we'll have somebody touch base with you as soon as possible. Um, and this team spends a lot of time. It's very important to us to have one-to-one dedication, to have conversations independently and individually, to understand your specific questions and what you're trying to accomplish so that we can help decide which path is the right one for you, or if a path is right at all. So we take that very seriously. So they spend a lot of time in conversation. Every year. I did the math on how many conversations they have each year, but it's escaped me. And we appreciate everyone joining today, our guests, our panelists. Also, if you enjoyed this today and you want information on other topics, I would encourage you to check out our other channels, specifically our YouTube channel. Everything that we do for webinars ends up on our YouTube channel, ACHS TV. And there's years worth of content on there. So if you enjoyed today's presentation and want to see others, check that out. There's a lot to dig through there. So anything to add before we break? Oh, Shannon asked, did I miss the link for the video on how to study?
If you, I think, Troy, you may have grabbed it. It's probably earlier up in the chat or something, right?
Yeah, I put the NANP board certification link. And I believe
Scroll
that,
down about halfway on that page and you'll find a link to the video right there.
yeah, thank you. All right, any other questions? I appreciate everyone's questions along the way, but I want to make sure we don't have any more in mind before we break. But if you do think of something after we close today, which is always the case, feel free to reach out and we'll be in touch as soon as we can. All right. Thank you, everyone. Thank you for joining us. Have a great and wonderful afternoon.
Thank
Thank you
you.
so much for the opportunity.